section. There are generally two types of cesarean section: an elective, which is a planned cesarean section, and an emergency, which is done if the woman is already in labour or if a condition presents itself and the baby needs to be born very quickly. Now, here in Australia, the rate of cesarean section is on the rise, and we've recently hit almost 35% of women having a cesarean section. Now, this well exceeds the World Health Organization recommendation, which is between 10 and 15%. And we've actually recently overtaken the United States, which had a reputation for a very medicalized birth system that had very poor outcomes for mums and babies, some of the worst in the developed world. So, when we compare to then countries like the UK that has a cesarean section rate of 15%, or Finland of 6%, then you can see that there are a lot of unnecessary cesarean sections that are happening in Australia today. Now, we're going to talk about some of the reasons for an elective and an emergency cesarean section. But it's really good to be mindful of the reasons why you might be offered a cesarean section, and then do your own reading and research and use that BRAIN acronym that we discussed in this course. Now, especially important to be mindful if your model of care is through the private health sector. Now, the private health sector is known and very well documented to have very high cesarean section rates, well above the national average and public health system. And this is generally for a few reasons, actually. So one is that in the private health sector, women can choose as an option to have a cesarean section, whereas they can't do in the public sector. They must have a medical reason. Another is that if you do engage with a private obstetrician, they are very confident with cesarean section. It's their bread and butter. Many of them may not have seen a normal water birth, but have done a multitude of cesarean sections, so it's what they're really good at. The other thing is it's much easier to plan a cesarean section in terms of scheduling when you're caring for a large number of women than it is to be on call and be called out in the middle of the night, when you're caring for that high volume of women. So really important, again, to understand why. Look into things yourself and use the BRAIN acronym if you are being recommended a cesarean section. Now, the other thing to consider is the timing of the cesarean section. So a recent study done by the Safety and Quality Commission of Australia into healthcare found that almost half of the cesarean sections that were done before 39 weeks didn't even have a medical reason, and that this is damaging to babies. As babies born before 39 weeks without a genuine medical reason then face unnecessary complications such as breathing difficulties and even learning difficulties later in life. So even if you do need a cesarean section, discussing the timing of that, understanding that the longer that baby can be inside, the better. Obviously, you need to discuss this with your doctor and weigh up the safety, the pros and cons of around timing and around leaving it and all of this. Everyone's situation is different. But please consider that just because you're 37 weeks does not mean that baby doesn't have more growth and development to do inside of your tummy. Now, some of the reasons for an elective cesarean section as listed by the Royal College of Obstetricians and Gynecologists in Australia, or RANZCOG. So some of the reasons that they have provided for an elective cesarean section include if you have had a previous cesarean section. Now, again, important to note that the old saying that used to be once a Caesar, always a Caesar is untrue. Okay, so for most women who have had an uncomplicated cesarean section previously, they a lot of the time are very good candidates to go for something what we call a vaginal birth after cesarean, or a VBAC. So please don't just think, oh, I had a Caesar before, so I have to have one now. Actually, that's untrue. And even after multiple cesarean sections, some evidence is emerging that it's just as safe to then attempt a vaginal birth. So please look into that for yourself. One of the other reasons is if your placenta is too close or covering your cervix. So this can be a genuine reason for a cesarean section, as if you go into labor and your placenta was covering your cervix, that could have very serious complications for you and baby. The next reason is a breech or transverse baby that cannot be turned into a head down position. Okay, so this is when baby's head is up or to the side instead of down in the pelvis. Now again, there are a range of different ways that this can present, and in some cases there are obstetricians who will support women to have a vaginal breech birth. So looking at your individual circumstance, doing a bit of reading and research for yourself, having a chat to your obstetrician, and maybe even looking, because there are situations where one obstetrician won't support it but others will. So really having a look and doing your own reading and research, really important with that also. Another reason for an elective might be a twin or multiple pregnancy. So depending on what kind, how many placentas and things like that with your twin pregnancy, that can be a genuine reason for a cesarean section. Another reason might be if you have a history of a traumatic birth experience that resulted in a complication such as a 3rd or a 4th degree tear. Again, doesn't mean that you have to, but this can be an indication for another cesarean section. So what you'll notice on this list is that things like a big baby or a baby that's not descended into the pelvis yet are not actually listed by the governing body of obstetricians in Australia. So if you are being told by an obstetrician that you need a cesarean section for either of these reasons, again, you might like to get a second opinion, or ask some more questions and do a bit more of your own reading and research. Now, reasons for an emergency cesarean section include a threat to mum or baby's well-being, labour not progressing, or a maternal or neonatal emergency. So if it is something like labour not progressing, you might like to use that BRAIN acronym that we discussed in this course to see if having a bit more time or trying an alternative could be potentially an option to help you try and achieve a normal birth. And even if you don't in the end, even if you end up needing that emergency cesarean section, if you've given it everything and if you've tried all of the options, instead of emerging from your birth going, oh, if only I had have maybe tried this, things could have been different, you'll emerge from your birth going, I know I gave that everything and I really was active in the decision making around my care, and I know that that was the right decision for us at the time. You will emerge from your birth much less traumatized than if you feel like you were coerced into a cesarean section. Okay, so please use the BRAIN acronym and be an active participant in the decision making, and ask as many questions as you need to if you find yourself in this situation. tips for a cesarean section and recovery. Firstly, I just want to acknowledge that a cesarean section is still a birth. It's still the moment that your child enters into the world, and you are still the one who has created and given birth to life, okay? So even though it might feel like a major medical event and it may or may not have been something that you wanted, I want you to know that you did this. You are incredibly strong and powerful. There's no easy way out of birth. You know, it's not the easy way out at all. And Caesar mamas are incredibly beautiful and strong. Okay, so some tips. You can still do delayed cord clamping. Okay, so that's where we leave that cord attached. If baby comes out and cries, then the obstetrician can generally hold baby there and give baby even just 30 seconds or a minute, of delayed cord clamping, and all of those additional benefits to baby, which is really powerful. The other thing is ask for immediate skin to skin. So once baby comes out, if baby has had a little bit of delayed cord clamping, if baby's breathing well, baby should come straight up onto your chest. If we think about for our little Caesar bubbies, they've been tucked up inside of your tummy and then all of a sudden out into the big wide world, and it can be a little bit of a shock for them sometimes, and that's why some babies, when they're born via cesarean section, especially if it's elective and mum hasn't been in labor, they can take a little bit of time transitioning their breathing. And so this is because they're quite stressed. Okay, so they're breathing really fast, hyperventilating. And so that immediate skin to skin with mum is so calming, for baby. Baby can feel mum, smell mum, feel mum's heartbeat. And this is where, baby's breathing will calm down. They can transition into extrauterine life. They stabilize their blood sugars. It's the best place for your baby to be. So if mum feels up to it, that immediate skin to skin, and if you're going to breastfeed, you can breastfeed here. And that's amazing for your baby as well. We know how important that first hour is of baby being able to be skin to skin and breastfeeding. So if you're having a cesarean section, that should not impact on that. You can still do this, but you might need to advocate for it a little bit. Some other things are creating that birth environment so you can still have your favorite song playing. Ask the anaesthetist, if they're happy to put on that song for you. They generally are, and a lot of the time they'll have their own music playing. So, you can still do that to create a more personalized experience for you. And sometimes as well, especially if you're having an elective cesarean section, you might like to talk to the obstetrician about a maternally assisted cesarean section birth. And so that's where you're given sterile gloves and baby is passed straight up from your tummy up to your chest, and you help bring baby up. And that is such a beautiful, empowering experience. I don't believe it's something that's offered everywhere, but definitely, if you're interested, I strongly recommend having a chat to the obstetric team about that, or something similar, some kind of variation of. So once baby is born and then the cesarean section is finished, you will then be wheeled to the recovery, okay? And this is where the nurses and the team will just make sure that you're stable, that everything's well. You can do some more skin to skin and breastfeeding here. And once the team is confident that you're well and Bubby's well, then you'll be taken up to the maternity ward. Now, up in the maternity ward, they'll look after you and teach you how to do wound care. You'll be provided, you'll probably already have them, with TED stockings and Clexane, which is the injection to help reduce your risk of blood clots. The catheter will eventually be removed as well. And it's important to consider that that after your cesarean section, as soon as 6 hours post-birth, you will be asked to hop up and have your first shower and start to mobilize. Now, this can feel really, really daunting after major surgery, and sometimes we might think, isn't the best thing to rest? But actually, Getting up and mobilizing here is the best thing for your recovery and will help you recover quicker and have less pain, all right? So this first time getting up, it is intense. You can feel nauseous. My recommendation is just take as much pain relief as you can, okay, to help you get up here, have a shower, and then hop back into bed. But after that, then you can start mobilizing, okay? And doing some gentle mobilizing after your cesarean section is really, really important, like I just said, for your recovery and reducing your risk of blood clots as well. And so speaking of pain relief, continue taking your pain relief. You do not need to be a hero. You know, the doctors will only prescribe pain relief that's safe for breastfeeding anyway, okay? And it's actually better for you and your breastfeeding and your recovery if you take lots of pain relief, because if you're pain-free, you will mobilize more, and your milk will come in quicker, okay? When you're in pain, that releases stress hormones, that blocks oxytocin, that blocks your milk supply coming in, all right? So we want you to be pain-free so you can care for baby, skin to skin with baby, feed baby, and move your body, okay? It is good, however, to have a support person with you and to stay with you if the hospital permits it, because even though we want you mobilizing, it still is tough. So having that extra pair of hands there to help, you know, pass baby to you and things like that, you know, is so helpful. And lastly, I will say, doing as much skin to skin and feeding with baby as you can tolerate, is really, really helpful, because sometimes we do know that milk supply can take a little bit longer coming in for mums who have had a cesarean section before, you know, and whether that's an emergency or an elective, it can be the case. So trying to counteract that with as much skin to skin and feeding as you can is really going to be beneficial to you and Bubby.